At a time when the world wants to move on, and I'll talk more about that in a bit, this institute is demonstrating leadership, saying we can't move on, that we are entering a time period where the work of this institute is as important as ever. And years ago, 5, 7 years ago, before this pandemic, I often used to talk about that we were entering an age of pandemics. Sounded very scary. But I want to take a minute to talk about why I think we're entering an age of pandemics. Why the work of this institute is important now and will be more and more important as the years go along. So if you ask, like, what causes pandemics, right? Pandemics have been around as long as humans have been around. And what causes pandemics is usually novel infections, a new virus, a new agent of some kind to which we don't have immunity. And it spreads rapidly in a population. And there's a whole set of factors that drive something becoming a pandemic. And if you look at what's been happening to the human species over the last 50 years, you get a sense that we've entered a new era. The number of novel infections that are showing up in humans has been increasing over the last 30 years. You're like, well, why is that? A vast majority of novel infections come from animals. They're usually species jumps. That is not my way of saying that's what happened with SARS-CoV-2. That's been very controversial. I'm happy to talk about that if you want. But that's how most novel infections happen. They happen when there's an animal to human jump. And given what is happening in our world, deforestation, broad environmental changes, economic development, humans are encountering animals at a pace much different than we ever have in the history of our species. But a couple other things are happening as well. We've got that. And then on top of that, we've got climate change. And that means habitats are changing, vectors are changing. And then we have globalization. Globalization means that things that used to be local become global very quickly. And I'm reminded of the fact that we're talking about SARS-CoV-2 as the latest pandemic. There was a SARS-CoV-1, all of you know that well. I mean, some of the younger people in the room may not remember it, but Toronto was a center for SARS, the original SARS outbreak. In 2003, if you compare travel within and outside of China from 2003 to 2019, domestic travel in China between 2003 and 2019 increased about 20-fold, and global travel increased about 35-fold. So it's interesting to think, what would a SARS outbreak have looked like, SARS-1, if it had happened in 2019? Maybe it wouldn't have been quite the global pandemic we saw with SARS-2, but it would have been much bigger. And that globalization has happened in China. It's happened in India. It is rapidly happening on the African continent. And my view is that's a good thing, by the way. It's economic development. It's the world becoming more interconnected. There's a lot of benefits. I want to live in a world that's very interconnected. But the downside of that is that local outbreaks become global outbreaks very quickly. So that is the age in which we are. It is the age of pandemics. And I think we have to just come to reality with that, or come to terms with that. Now, the second thing that people often bring up and think about is, well, can we predict pandemics? Can we predict when it's going to happen? And there are a lot of models out there. And when I was at the White House, we'd often have companies saying, we think we can predict the next pandemic. Great. I don't know how to predict the next pandemic, honestly. Like, the number of factors that have to come together is very, very, very hard to build a prediction model that says the next pandemic will be, we can make guesses. My best guess is the next pandemic will be an influenza pandemic, maybe arising from certain regions of the world. By the way, that was my prediction 5 years ago. 5 years ago, I would not have said the next pandemic will be a coronavirus pandemic. So predictions are hard. And so the way I have come to think about the moment we are in is, can't prevent these things, given that we're going to have more environmental change, that climate change is here, that globalization is going to continue. And you can't predict these things. So what can you do? And what you can do is prepare. And what you can do, and what we all need to do, is be ready as these things come and be far more effective in our response. And if we do that, I think we can manage our way through the era that we are entering. So what I want to do for the next 10 minutes or so is talk about managing a pandemic. And, look, the last 4 years, you can look around the world, you can look at Canada, you can look at the US, the European countries, Asian countries. I'm not going to list all the countries in the world, but you get the point. There are lots of lessons to be learned. Lots of places did them differently. And I will share with you my sort of high level how to think about managing a pandemic, what the lessons learned are. Your views may differ. And I am on these things pretty simple and straightforward. And so when I think about responding to a pandemic, I think there are two phases. People like to break it down in lots of phases. I'm a simple person, 2 phases. Phase 1, when you largely don't have medical countermeasures. Phase 2, when you do have medical countermeasures. I'll explain all this, what I mean by all this in a second. So if we go back to asking why are pandemics bad, right? We have lots of viruses out there. We encounter them all the time. Why was SARS-CoV-2 so bad? Fundamentally, it's bad because we don't have immunity. We have a whole population totally susceptible to a virus, and we have no immunity. That is the kind of hallmark of a dangerous situation for the human population. So at a high level, my view is the response to a pandemic is gotta be save lives, keep people well, until you can build up immunity safely. And the safest way to build up immunity is through vaccines. Infections also build up immunity, but infections have lots and lots of downsides. The safest way to build up immunity is vaccines. And so obviously there's lots of other things to medical countermeasures like treatments, et cetera. But I want to talk about, in some ways, splitting our response between when you don't have vaccines and when you do have vaccines. Now, there's still people who believe that the primary strategy of a pandemic, it should be an elimination strategy. That you encounter the virus and you try to eliminate it, just get rid of it. It depends a bit on the virus, but I think for a respiratory virus, certainly like SARS-CoV-2, that was always extraordinarily hard. I don't personally believe it was ever doable, but at some point it became obvious that it was not going to be done. And so we find ourselves saying, if we're going to have to live with this virus, how do we do it in a way that protects people as well as possible? And by the way, some of you may disagree with that and think elimination is possible, and maybe we can talk about that in our conversation. That's just, as I said, my assessment 4 years later, but it is not written in stone. Okay, so what's the strategy during the period of time when you don't have medical countermeasures? Here, my view over the last few years has been that essentially what you're trying to do in many ways is buy time and protect lives while you're waiting, in some ways, for the science to catch up. And I'm going to talk about this a little bit from an American perspective. It's what I know. In my view, there are sort of 2 or 3 things that are really critical in that phase when you don't have vaccines. And therefore, there's no safe way to build up immunity, right? Number 1 is surveillance. I have said publicly, privately, in Congress, elsewhere, that the original sin of the American pandemic response was the lack of a surveillance system. And let me take a minute to explain what I mean, and it'll be interesting to see to what extent you think that applies here in Ontario or in Canada more broadly. We had no surveillance system in the United States that was at all functional. And so when this virus started spreading between mid-January, and maybe it started before then, I don't know, but when it started spreading between mid-January of 2020 and really early to mid-March, when it became clear that it was a huge problem, for 2 months we were blind to the spread of this virus. And then the response that came from states, from President Trump, was essentially a national shutdown, national lockdown. We can talk about, was it a real lockdown? Should it have been a harder lockdown? Should it have been a longer lockdown? Those are perfectly good things to talk about, but that's what it was. And in my view, that sowed the seeds of distrust in the following way. We could all see the refrigerator trucks parked outside of Elmhurst Hospital in New York City. The hospital was overwhelmed. People were dying in extraordinary numbers. And a lockdown in New York City made a ton of sense. The problem was there was no virus circulating in Mississippi or Montana at that time. And so when you lock down Montana or Mississippi, people walked around saying, there's nobody in the hospital. I don't know anybody who's got this infection. And we all understood why we did it. But it certainly created the atmosphere where people were susceptible to the narrative, this is all fake, this is all made up as a way to take away your freedoms. And what would have been way more effective if we had had surveillance was much more targeted efforts. We probably should have been harder in New York earlier, but could have been lighter in Montana. But that would have required us to actually know that there was not a lot of virus circulating in Montana. And we didn't have that surveillance system. So the lack of surveillance system means that your NPIs, as we talk about them, non-pharmaceutical interventions, are always going to be blunt. And that's costly. So a surveillance system is pretty critical. I think we've made progress there, and I can talk more about that, and we can discuss this. The second part of the response when you don't have vaccines and other medical countermeasures is communication. So in public health, we have often thought about science communication as a nice to have. Like you figure out the science, you figure out the policy, you go implement it. Oh yeah, by the way, you also want to try to communicate it to people. It turns out that's a terrible way to think about it. It's backwards. And that communication with the public in a public health crisis is got to be job one. So you've got to be able to explain to people what you know and don't know, what you're asking them to do and why, and for how long, and communicating in a crisis where you don't know all the information has its own set of challenges. I think none of us got it right. Certainly I didn't get it right. But I think more communication is better. And the problem that we have as scientists is scientists like to be pretty sure about things before they go out and tell people. And that creates an information vacuum in a crisis. And there are lots of people who are happy to fill information vacuums. And so the second lesson is, so one is surveillance. Second is, you got to communicate early, got to communicate often. You got to flood the zone with the best information you have, because there is a massive demand for information in a crisis. People are hungry for information. And I think we did not meet that demand. Certainly in the United States, we as a collective, what do I mean? The government, well, the government at times was also sharing what I thought was really bad information. We had a president who didn't always follow the scientific evidence in a way that I wish he had. So we did not flood the zone with good information, the best information we had. And that created a space for a lot of other people to fill it with bad information. So that's a really critical part of the response. And then I've sort of talked about the importance of NPIs, targeted restrictions on mass gatherings, mask wearing. We'll talk about indoor air quality, which I loved. I walked in and saw these boxes, and but ventilation for a respiratory virus. Those are all really critical things. Some of them continue past the arrival of vaccines, but they were particularly critical in the pre-vaccine phase. And the last point I'll make, and then I want to talk about vaccines in a second, is you're not just waiting for vaccines to arrive. You're also waiting for us to learn more about the virus. And here's an interesting fact. My best assessment is that between March of 2020 and October of 2020, so both time periods before vaccines became available, remember, if you walked into a hospital in Boston or Toronto with COVID, your chances of dying were probably cut by 50% between March and October. That is remarkable. 50% reduction in mortality in a period of about 5 months. How? We learned stuff. We learned who really needs a ventilator, who doesn't. We learned that steroids are actually quite useful. We just learned how to manage these patients better. And that 5 months, even well before vaccines arrived, meant that a lot more people survived. So in the beginning, when you know very little about a virus, you've got to do everything you can to give the scientific, the medical, the public health community time to catch up. And so that's why I was pretty, in my public messaging, pretty tough about really being aggressive in that time period. Okay. I want to move now towards, and again, I'm happy to talk about any of this stuff in the Q&A, but I want to talk a little bit about vaccines and what we need to do if we are indeed entering an age of pandemics, what we need to do to make sure that we're better, more effective at building vaccines. So as many of you know, and I've said this certainly publicly many times, we got lucky with the vaccine for SARS-CoV-2. We got extraordinarily lucky. The reason I say we got lucky is SARS-CoV-1 had taught us a lot about how to build a vaccine against SARS-1. We knew about the spike protein. We knew you had to target the spike protein. We had done a lot of work. So when SARS-2 showed up, everybody was like, oh yeah, target the spike protein. And it was not, I mean, I don't mean to minimize the amount of work that went into it, but it was a way easier job than if we did not know that. And so I think we have to assume that the next pandemic will come from a virus where we're not lucky. Certainly being lucky can't be your strategy. Like, let's hope we're lucky again. Sure, but that can't possibly be our strategy. So we need sort of a multiple part approach. And this is a lot of what I try to push us as a US government to do. There are viruses where we have vaccines where we think there's a good chance that they could cause problems. And so building and stockpiling vaccines is a really important part of the strategy.